Singapore, Taiwan and Hong Kong have brought outbreaks under control, and without resorting to China's draconian steps. These countries are very vulnerable with the spread of this infection because of their location and close links with China. After 3 experienced outbreaks from SARS, MERS and the likes, controlling the outbreak became stabilized for now. How they do it is a combination of experiences, and they have done so without embracing the highly disruptive drastic measures done by China. Singapore. As governments from Iran to the United States come under fire for disjointed and delayed responses to worsening outbreaks, Singapore has been methodical in disclosing information about infections. Meaning, details about each new case were posted daily by the government down to the person's sex, age, nationality and the exact street they live. Singapore was detecting 3 times the number of COVID-19 cases as other countries, compared to other countries, as studied by Harvard University public health researchers. Thanks to the contact tracing procedures and surveillance that was done epidemiologically. To locate anyone who might have been exposed to the virus, as many as 100 Singaporean police investigators helped question patients and their close contacts. Anyone entering a major office building has his or her temperature taken by a thermal scanner or a guard with a digital thermometer, and is required to log their phone number and any recent travel to a virus-affected zone. Police also have access to one of the most extensive surveillance systems in the world, with more than 86,000 closed-circuit TV cameras blanketing the island. Hong Kong. Just like Singapore and Taiwan, travel restrictions was proactively implemented without exception on travelers coming from mainland China, disregarding the World Health Organization insistence that travel bans were not necessary at the moment. The precautions came at a significant economic cost which relies on mainland China as its biggest trading partner and source of tourists. Communication also plays the most important role to combat this disease. Long before the coronavirus, SARS outbreak produced a number of problems like insufficient communication with the public, poor supervision of the health department, inadequate monitoring of the hospital authority, and without having a contingency plan for large-scale outbreaks. Those experienced during Minister Yau were now corrected. The minister turned academic is now head of public health at Chinese University, which gives him a better vantage point than most to study, if the city is handling the current crisis better than it did 17 years ago. Yau quoted, "One of the most important responses for any outbreak is communication," he said. It is not simply about handing out leaflets or holding daily press conferences. It is also the understanding of the impact on every sector of the community. Taiwan. The World Health Organization received a notification from Taiwan on December 31, 2019, that it has several cases of unknown type of pneumonia, according to Taiwan Centers for Disease Control. Without compromise, they immediately ordered inspections of passengers arriving from Wuhan, China. Taiwan asked and received permission from Beijing to send a team of experts to the mainland on a fact-finding mission on January 12. Shortly after the team returned, Taiwan began requiring hospitals to test for and report cases. These helped the government identify those infected, trace their contacts and isolate everyone involved, preventing the virus from spreading to the community. All this happened long before Taiwan confirmed its first case on January 21, and the rest of the world became alarmed. Since identifying the first infections, all imported, on their territories on January 21 in Taiwan, and on January 23 in both Hong Kong and Singapore, all 3 governments have implemented a reliable combination of measures. Number 1. Reduce the arrival of new cases into the community, travel restrictions. Number 2. Specifically prevent possible transmission between known cases and the local population, quarantines. And 3. Generally suppress silent transmission in the community by reducing contact between individuals, self-isolation, social distancing, heightened hygiene. But each has had a different approach. Singapore, Taiwan and Hong Kong are 3 places with perceptibly different socioeconomic and political features, have been able to disrupt the chain of the disease's transmission. And they have done so without embracing the highly unsettling, extreme measures adopted by China. The key to their success so far has been the decision to respond aggressively from the outset. This success suggests that other governments can make headway to aggressively combat this crisis.